everyone, and welcome to On Air with B&B.
I'm Brittany.
And I'm Bethany, and we are two mental health therapists with real talk and mental health tips that matter. Today, we are going to be touching on a topic of how to be a safe person for kids while still setting important boundaries. Something in my throat.
Yeah.
And what I kind of mean by that is, I think at one point, most people, most adults, whether you're a parent, a teacher, a clinician, a coach, if you're involved with children on any level, you've thought to yourself, gosh, I really want to be that adult that, the kids can just come and talk to me about anything. I hope they feel, safe. How can I do that? And there is a way to do that. And that's what we're going to talk about today. But also we don't want to enable when we're doing that.
Right.
And I feel like enabling is has such a negative connotation with it, and the fact that you hear the word enable and it just everyone goes to that's negative. But I feel like the intention of enabling is always good. Why do we enable? We enable because we want to show support. We enable because we want you to do well. We enable because we want you to feel not judged. But this particular video is going to talk about how to do that, but while also holding you accountable, so that you can learn and also get the message that we believe that you're capable of getting through hard things. Because sometimes when we support and we don't judge, but we don't also hold accountable or problem solve or ask questions that lead to growth, then we're sending the wrong message.
Yeah.
I hope I said that correctly.
Yeah. I think it's just, not enabling means just holding the child accountable, kind of like what you were saying, and also growth points. I think as parents or coaches or teachers, you do to a certain capacity have to be comfortable with the understanding of, you're not this child's best friends. Right.
Right.
And right now you will not be, maybe when they're adults and things of that nature, and you can have a different relationship. But the type of relationship you want to foster with your children and adolescents and even teenagers and younger adults, if you will, like as children or as your child, right? I think the important thing is realizing in this moment, if I let them fail, will they learn from it?
Yeah. And I was thinking on how you just said, you're not your children's best friend. I think that's such an important point because I'm so sorry. I'm so gassy today. Yeah. But I think that when people, in my personal life, my best friends or my husband, when they're venting to me, unless they're asking me for my advice, because I'm not their parent or their role model or an adult authority figure who's supposed to be teaching. My role is not to teach my best friend. My role is not to teach my husband anything. If they ask your opinion, was this a good idea, whatnot, okay. But typically, even when I think that maybe they handled a situation maybe they could have done it differently, I don't say so unless they're asking me. I just support because it's okay, you just want someone to vent to. You just want somebody to listen to. Right? Yeah. But as an adult to child, yes, we also still want to show that support, but in a way that is teaching them, something Absolutely. So going back to that growth piece, and you can't, so you aren't their best friend. You aren't just listening. And so you do have to allow them to fail and then work through that failure with them, so to speak. I'm thinking a good example of inappropriately or being that person, a safe person, so to speak, that a kid comes to and not holding them accountable, so not setting important boundaries, would be, let's say a child or your child, you're a parent, so I'm a parent, and your child comes to you and says, Mom, I just really hate riding the bus. Like this is the first year they're riding the bus. Maybe you've always taken them or, to school before. And now they're riding the bus and, they're having severe anxiety about it. Whether there's an actual, reason for the anxiety, like they're getting made fun of on the bus, or there's not. It's just in their, something they're scared that's going to happen, but it's actually making them, like some kids, it's my kids vomiting before school because they're so
Yeah.
scared
Or
to
my
ride the
stomach
bus.
ache.
And then so you, instead of, because you want to be a safe person, you're like, I'm gonna start taking you to school
Right.
again, and even though it makes you late for work or it's out of your way or whatever. And yes, it will alleviate the child's anxiety, but it also sends the message of, I don't think you're capable of like getting through this anxiety
Yeah.
without me.
Yeah.
Right.
And I would even argue, like, does it even actually alleviate the anxiety symptoms? Maybe in that moment, but not long
Right.
term.
That's what I meant
It
to say.
definitely, yeah, it definitely exacerbates, I think, over like the longevity because you're not addressing, right? It's kind of like I even had, you know, in our parent support groups at our office, one of the parent support groups, it's kind of like I gave this example that seems kind of like juvenile and like not even important, but um, as a mom or as a dad, or even as like a babysitter, even, right? And you're going to take this kiddo to a new park, right? And maybe new is something that's like uncomfortable and difficult for them. And you pull up to the park and you park the car, and before you can even open the door, there's like a huge meltdown, right? And if you get back into that car, buckle your seatbelt, and drive off, what message are you sending? Granted, most adults, whether the role of a parent or legal guardian or babysitter, grandparent, things of that nature, they're like, well, they were really uncomfortable and I was trying to provide
Mhm. It
comfort.
always comes with a good intention.
Yes, positive intentions, right? But, in that moment, kind of like what Bethany was just saying, like you're kind of portraying this narrative of, when things get tough, it's okay to give up,
Yeah.
or I don't believe that you're capable of overcoming any adversities or like struggles, if you will. Like, I don't believe that you're capable or strong enough to do that.
Yeah.
Unfortunately, those are the underlining messages that they're not receiving in that moment, maybe, but eventually they will receive that message through unhealthy habits that are going to be created
Yeah. And I
from
think
that.
it's important with this particular topic today, um, to point out too that yes, it might get to that point. Like I'll go back to the bus example. It might get to the point of like, okay, we're going to find part of the problem solving process was, first we tried, using breathing techniques, or we tried using CBT, or we tried making a friend on the bus, or sitting with a friend, or talking to the bus driver, talking to administration,
Yeah.
um, we try all these things. And then down the road, we end up not going on the bus anyways. I'm not saying that that's never the outcome because sometimes it just has to be. But I think if we provide a place where our kids can talk to us and open up to us, and then we raise questions of, well, have you tried this first, and we
Hmm.
try those things first, even if it ends up in the same outcome that we may have initially just gone for, they see that we again believed in them to get through hard things because we tried all these other things
Yeah.
first. Right.
Instead of just giving up.
Right
Right.
away. Yeah.
I see a lot of like solution based focus kind of like techniques and interventions,
Hmm.
which are very effective. I think to circle back to like my example of like going to the park, right? Like a
Yeah.
playground, for example, in that particular situation, I would advise any adult to like, yes, stay in your car and park the car, but then just acknowledge the emotion or the feeling in the moment. Wow, like you must be feeling a lot of anxiety right now, kind of addressing the elephant in the room.
I felt that way too before.
Yeah.
I hate walking in a room when
Yeah.
everyone's already there and then I'm the last one and everyone turns around and looks
Right.
at you.
Or like I'm worried that I'm not going to know anyone at this park, or it's like a new park. What if I don't make any friends? Or like a lot of like negative intrinsic thoughts can come come across their like little minds, of course. And so these are all really important things. So I think for my example, for the playground or for the park, I think it's important for the adult to address the elephant in the room, address the emotions and the feelings, normalize it, and then create a solution without the only solution being to immediately leave. Because what are you teaching? Again, you're teaching poor habits. Now, let's utilize and do some type of analogy, if you will. Okay, so let's follow along really quick. So, with the playground park, example, what if the same type of behaviors with the same adult and same minor client exhibits that same like same everything to a T, if you will, in a capacity of going to the doctor's office? Now, is going to the doctor's office optional? Not in the United States of America, right? Like you
Well,
can't
that
really,
depends.
it depends, but like not here, especially if your child is like in public schools or in private schools that require different documentations and things of that nature, right? So I feel like it's fair to say going to the doctor really isn't negotiable in all circumstances across the board, right? And so, fair to say that going to the doctors is something that we have to do, whether they have to get shots or lab work or physical examinations or because they're sick or whatever it is. And doctor in the capacity of like either their pediatrician and or like a dentist. I know, unfortunately, they get a pretty bad negative stigma as
The
well.
dentist?
Yeah.
Yeah, I don't
Yeah, they
even
don't
like
get a positive
going,
rep. Yeah. So I
but
think for those situations, like if the child presents anxiety symptoms comparable to what was happening in the playground of the park, it's happening in the doctor's office, but they recall maybe yesterday at the park or last week at the park or 2 months ago at the park, this is how you responded. So if I'm anxious and I respond in this manner, mom, dad, my babysitter, grandma, my aunt, my uncle,
will
whoever's
take me
taking me,
out of
they're
here
going to
as
just remove
well.
me as well,
Yeah.
right? And so just bearing that in mind, granted, you want to be a safe person, right? So again, how can you be a safe person if your child is having a full on tantrum that's pretty much anxiety induced in the parking lot or in the waiting room and refusing to go into the door to see the dentist or just see their like pediatrician? Like, how do you handle that? Acknowledgement, normalizing, encouraging, right? Praising efforts. Wow, I like that you're trying to breathe right now if
Hmm.
they're actually engaging or even entertaining.
Let's do this together.
Yeah. And so let's doing that together as well. And sometimes you do have to take a few steps backwards in order to obtain or get some level of progress. What do I
Hmm.
mean by that? Sometimes you got to like if this behavior is happening like in the waiting room, sometimes you have to go outside, change of environment, change of scenery, do some
Hmm.
breathing techniques outside, do the 5 4 3 2 1 mindfulness grounding technique outside. What are 5 things that you can like see right now, or 5 things you could touch? What are 4 things that you could see? What are 3 things that you hear? Do you hear the birds, right? What are you smelling? What's one thing that you can taste? Oh wow, like I have a special candy in here, maybe you could try to taste that, to like entice them to do these like activities to calm them down. But notice how like Bethany and I are not suggesting just like giving up or running off or running away or removing them from the situation,
Hmm.
right? Granted, I want to acknowledge and verbalize that yes, in those moments, kind of like what Bethany was saying, we acknowledge as professionals, as clinicians, we do recognize that there's no ill intentions. It's not coming from like a malicious standpoint. It's actually rather the polar opposite. Like most adults, regardless of role, engage in those behaviors because they're just trying to protect in that moment,
Yeah.
but not realizing that it's causing, in a longevity like perspective, like more detriment, right?
Definitely. I think another example, but it's more geared towards um, not swooping in and saving the day due to anxiety, but like sticking to the topic of like being a safe person to talk to with setting, like while still setting boundaries. I have this a lot because I see a lot of teenagers. So we're not necessarily talking about anxiety. We're talking about a lot of things like social things that are happening at school, and then the kid will come in and they're venting and they want to tell me like this particular kid or group of kids or whatnot has been so mean to them and this and that and causing so much trouble at
Mm-hmm.
school, and maybe finally they retaliated and that's what they deserve, and
Mm-hmm.
and da 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 da. And obviously in the back of my mind as like an older person who's experienced more things, I want to say, well, just because they act that way doesn't mean you want to act that way, or like,
Mhm.
you handled that wrong, but I get it because, they've been like terrorizing you or harassing you for months now. And so that's like a really tricky one. Like, how do I remain the safe adult that you want to talk to and tell me all the things that you're doing as well that may not be appropriate, but without making you feel judged,
Yeah.
right? Because that's a tricky one, I think, for like teachers and guidance counselors and parents and clinicians, because we want to send that message of, I totally get why you reacted this way, but also tell you, like, yo, don't act this way,
Yeah. Like, is
right?
that the most appropriate way, right? Like, so the best way that I do that with like my teenage clients or even like young adult clients too, or just adults in general, right? I think it's like, validating in that moment through empathy and definitely affirming, like, yeah, like I hear you, I understand, like it's understandable and for you to feel that way or want to respond that way, right? But now that we're sitting here, you and I in session, thinking with clarity about a past experience or past episode, right? If this were to happen again, because we
Hmm.
can't change the
Nope.
past, right? And I don't like to reflect on the past.
You already told
Yeah.
them and everyone around to F off and
Right.
showed
To
your
do
behind
whatever
and
you
right. So
did.
that
Yes.
happened. And we
So
don't want
that
to make you feel shame over how
cor-
you responded.
correct. But as a parent, any adult, right? Regardless of role, teacher, coach, whoever, nanny, babysitter, can even just say, like, hey, Bob. I don't know why Bob just came to my mind.
I
No,
don't
Bob,
know either. I don't
Bob
really know
was
any
like,
kids named
I don't.
Bob.
But anyway,
Maybe
Bob,
Bobby.
right. But
I
Bob was, yeah, now I'm just,
don't know any kids
I
named
don't know
Bob.
anyone Bob either. I was like, what the heck?
That's like a grown man's
It's
name.
weird.
Okay.
I know. Okay. Well, anyway, we're gonna roll with it. So Bob is like coming home because we talked about like anxiety and things like that, right? So let's just say Bob comes home and Bob struggles with like clinical depression. Okay. So Bob struggles with clinical
Probably because
depression.
you're calling him Bob.
Well, yeah, that's true too. Or and then even Susie, right? Different household, different kiddo. She struggles with ADHD, right? So these are two separate kiddos. And what if they both come home to mom, to dad, or to their grandparents, whoever is like raising them, whoever is like responsible for them, right? They come home and they just say, like, Bob, who's struggling with depression, I'm getting bullied again, right? Like, I really just don't want to go to school. Like, this is like serious, right? And it's like, as a parent or legal guardian, like, how do you remain safe and supportive while also maintaining those boundaries, right? Like, what can you do? Do you force your child to go to the school when they're being severely bullied? I wanted to bring up that particular example for this video because, unfortunately, all jokes aside, this is a very serious situation. And unfortunately, it happens far too often, right? I think in our society. And so if Bob were my client, I would, have a parent session and inform the parents that, I can't tell you what to do. But also allow them to like reflect, like, is this the only school that that Bob can go to?
Right.
Right? Like, what are other options? Because here's the thing, like, the goal is that Bob has to get an education,
Hmm.
right? But Bob doesn't have to get an education at this one particular public school that's in his specific zone, right? Now, for more like, rural areas and things of that nature, I fully understand that there's like very limited options in schools and things of that nature. But also just remind yourself too that there are, like, especially in the state of Florida Virtual School, which is deemed as public school.
Hmm.
So they do provide those resources. So there's other different resources. You also, aside from public school, in the capacity of in person or even online, right, for public school. There are private school options, homeschool options, co op situations that you could explore. And I think that would be a great example on how you can advocate while also maintain boundaries, but also still be supportive and taking the situation that Bob is experiencing with the bullying in an appropriate regard. What do you think, Bethany?
Um, so this kind of, not that my child was being bullied, she was not at all. But I'm just while you're talking about Bob, I'm thinking about my own child. And last year, actually, the last like 2 years of school,
Yeah.
she wasn't struggling, but she was just like she was in her school since she was 3. Last year
Mhm.
she was in 4th grade. The past 4th grade and 3rd grade, she got separated from all of her friends that she had gone to school with since she was 3 and gotten put in another class. And a lot of new kids were in her class, and she wasn't getting bullied, but she also was having like difficulty finding like strong connections.
Mhm.
And the combination of that with her rigorous academic schedule. Um, they had a lot of homework each night. And on top of, she has a lot of extracurricular activities too. And then we come to find out she also had anxiety, all kind of like together compounded and came to a head towards the end of the school year last year. And so she was coming home every day, and just every day was kind of a bad day. And so to speak on that, and part of it was, this kid was mean to me today or whatever, not bullying by any means, but, what we tried to do, kind of going back to this particular video, instead of just like automatically being like, you're having a bad day, or like, you're not really like getting any close friends, or it's too much homework, or this or that, and like we're just gonna like take you out of school and put you in another school or virtual school. First, we tried like reading books. Like, we hear you, that stinks. I remember I offered a time that like I felt that way when I switched schools, in middle school, to give her like a sense of like, I really truly understand what you're going through. We read books about like friends being friends versus being friendly. We talked about, green friends, yellow friends, red friends. Ways, we encouraged her to talk to people. We tried to look at a different way to structure the homework schedule to make it like more manageable. I mean, we tried so many things, again, before just like throwing in the towel on this particular school first, but also like, we're trying, we hear you, we support you, we don't judge you. But then it did get to a point where, even though we were trying all those things and she was trying all those things, it just doesn't have to be that hard.
Right.
So then we told her, you know what, we're open to exploring other options, and we
Mhm.
started going out and like doing interviews at other schools in the
Yep.
area, and and seeing what was out there. And I want to say she kept thanking us, like, thank you for at least considering this. Like,
Mhm.
we kept saying like, nothing's set in stone. You might still go to this school next year if we can't find something that's going to give you a good education and be a good fit. We're not going to just jump from one to
Right.
the other. But she kept saying, thank you for at least considering it. Thank you for at least considering it.
Yeah.
So it was like we were acknowledging and providing a safe place for her, but also telling her, like, that doesn't mean you're not going to the school next year.
Yeah.
And then we did find the right spot for her. And
Mhm.
she's doing really well this year in that spot. But it wasn't like, like Brittany was saying earlier, it wasn't just like we like just said, okay, you're having a bad day, we're going to pluck you from here and put you here.
Right.
We went through a lot of steps of being supportive and trying to help her find solutions that could work where she was at
Right.
first. It just wasn't really working, even with all the problem solving that was going on. And then we did end up switching. And so I guess that's what I would like to add to
Yeah,
this.
absolutely. And then for the other example, for like Susie or Sally or whatever I refer to that particular client, we'll call her Sally, I guess. So it's Sally with ADHD. Like if she comes home and she's like, mom or dad or whoever, right? Like I'm struggling focusing, or like has like a little meltdown or episode on the kitchen table while doing homework at night because it's so
Which we
hard.
hear from a lot of parents. We
Yeah.
hate homework time. Homework
Hmm.
time every night. How many
It's a
times do you hear this?
struggle.
Is so hard to get them to sit down and do it and to get it done.
Hmm.
And
Yeah.
yeah, it really is a struggle. I mean, for all kids, let alone kids with ADHD.
Absolutely. And so like parents would just say like, well, do I just email the teacher and just give in? And just
Ask
like
them to
let
make
them.
it less homework because
Right.
she has a 504 or an IEP plan, so we can get that accommodation if we really like I guess, fought for it.
Right. And so then it's just like, okay, well, just sitting down and like talking and like reflecting as a parent and as the adult, is the amount of homework or work in general that my child, like
That
Susie or Sally, has to,
unrealistic.
yeah, is it realistic? Like, is this an appropriate amount of work? And like actually looking at it and also evaluating, and highly recommend consulting with your child's like therapist and just asking them and just saying, like, hey, you know, with you've been working with my child Sally or Susie or whoever, right? Like, and you know that she does struggle with ADHD. Do you feel like this is an appropriate amount of schoolwork for the level of severity, whether that be mild, moderate, or relatively severe, regarding the symptoms consistent with the ADHD diagnosis that's present, right? So like looking at all of these different factors, I definitely recommend consulting with a clinician who's been working closely with your child. And unfortunately, if you don't have a clinician that's been working closely with your child, but your child does have a diagnosis, then looking at the different resources that that school potentially has, especially if it's a public school. Usually, most public schools have some, professional, whether it be a school psychologist or school counselor, that can provide different assessments and evaluations for a potential accommodations plan, whether it be an IUP or a 504 here in the state of Florida. But I do think it'll be important, in that moment, to circle back to the episode, if Sally or Susie or whoever is having like a meltdown or an episode, and you understand that this child has ADHD, rather than allowing her or him to give it up in that moment, right? Again, circling back as the adult, how can you be supportive and safe while also, holding them accountable as well? We want to make sure we're teaching and fostering healthy
Maybe
habits,
asking
right?
that child, Susie, like, you're struggling. What have you done to try to make this easier for
Mm-hmm.
yourself? To
Yeah.
see, like, has she tried
The
things? Maybe
coping
she hasn't. Maybe
strategies, see if she has to take a break
see if she's talked to
too.
the teachers, see if she's looked
Yeah.
into getting tutoring. A lot of schools offer free tutoring. And
Mhm.
that way, if she has and it's still not working, then you have more clarity on how you can help your child. And also holding her accountable to, well, okay, I hear that you're
Yeah.
struggling, but I'm also hearing that you haven't really done a lot to change your situation other than, just feel badly about it.
Right.
You know what I mean?
Yeah.
So
I definitely recommend to parents too to also have like a parent like teacher meeting or conference sooner rather than later. Like if you're noticing that this is like a habitual pattern in the first like 3 to 4 weeks of school, and you're noticing massive or even minor meltdowns, but they're relatively anticipated or expected at that point,
mhm.
set up a parent teacher conference or meeting and see how your child is doing in a school environment, because there's also, I'm not saying that this happens all the time, but it is a factor that needs to be considered, that, escape behaviors do exist, regardless of what any child is or is not diagnosed with anything, right? So, escape behaviors could be presented as like, the child just having a meltdown or a tantrum just to escape what they don't want to do, whether they're anxious or overwhelmed in the moment, or it's just a behavioral thing and they just don't want to do it, right?
Yeah,
And
and
it's not
speaking of like
preferred.
escape, because you're speaking of escape behaviors,
Mm-hmm.
I kind of want to touch a little bit. Like, we're talking about, how to be a safe adult for kids to come to while still setting important boundaries.
Yeah, I
But
already know
why?
that.
Like,
Yeah.
why should we do that? And I think, especially with our preteens and our
Yeah.
teenagers, the why is so that that children are talking to an adult about these things,
Yeah.
because we know that they talk to their peers, okay?
They're
That's
going
a
to hear it
given,
from someone else.
but you're talking to your peers who are just as experienced as you are. So if they're not talking to a teacher or a clinician or a parent or a coach or somebody, and they're only talking to their peers, they could be very well getting misinformation on how to
Mhm.
handle situations, bad advice,
Correct.
and again, not because these people are trying to give them bad advice, they're friends, but
Mhm.
because they don't have any real life experience to go off of, so they don't know.
Right.
And so, or they're not talking to anyone, and then you start to see them shutting down or
Mhm.
acting out, or just ruining their future, so to speak.
Yeah.
I have a client right now who he's in high school and he's had a breakup with a girlfriend, and it's his first love. So, oh man, I'm sure we can all go back and remember how poorly we handled those situations.
Mhm.
And he is in 10th grade and he is all consumed with this breakup,
Yeah.
and getting pulled back into every time she talks to him or every time she doesn't. And therefore, he is putting things online about his emotions, which we all need to follow Billie Eilish's advice: do not put your emotions online. Um, we don't want to post that. Because he's putting things on there that I try to explain to him, like when you get older and you have a job or you're trying to get a job, and then people find this could affect you 15 years later.
Yeah.
Okay. It never goes away.
Right.
Um,
But if he has a safe person,
right. To talk
I
to
think that's what
talk
you're
about
gonna
his
say.
emotions,
Yeah.
then that would be better. Or maybe he's not talking to anyone and then he's not focused on his homework or his schoolwork, and he flunks out of 10th grade, and then when he's trying to get into college later, it's really going to affect him,
Yeah.
because he's not talking about it with an adult and he's only talking about it with peers or not talking to anybody, and so it's not really getting resolved, and then it's coming out in his grades, which we all know in 10th grade, unfortunately, does affect
College. Yeah.
college, getting into college. So we want them to have somebody to talk to. We want them to feel safe going to somebody, and
Mhm.
somebody who can give sound advice, which is typically an adult.
Yeah.
So again, that's the why. Why do they need these safe adults? But also people to say, I hear you, but how could we have done that differently next time? Or
Yeah.
what part in this? Like, I totally think you're right. And I validate how you're feeling in this moment. But what could you have done differently? Because we can't control other people. So,
Right.
still holding them accountable for their part in it that they could have done differently, even if it is completely wrong what the other person did.
Yeah. I think too, another good thing, or another characteristic of being that safe person as the adult with like a minor individual, your child or student or, whoever. I think it's important to remember, and it's even okay to ask, especially with the teenagers and the older kids, just saying like, hey, before we start, because if they come to you, hey, can we talk? Or hey, I want to talk, or hey, I need someone to talk to. Great. Do you want to be heard? Do you want a hug? Or do you want help?
I like that.
Right? So the three H's, just asking them that so that you also know your intention as a safe person by respecting their boundaries and like their desires. And you're also letting them know intentionally and and unintentionally that you're like there to support them and you care about their needs and what can you as the adult do for them. I think that would be really helpful as
Yeah,
well.
I think asking what do you want to do about this
Hmm.
is another good question to ask. Going back to my own child when she was
Yeah.
having an issue with friends, she was telling me all the things that were hurtful and were happening. And instead of just saying, okay, well, I think you should do this, I said to her, what do you want to do
Hmm.
about it? And sometimes just even asking that question throws them off because they're not used to an adult like saying like asking
What
for
do
their
you want to
opinion. And it
do?
did kind of
Yeah.
throw her off. At first she was like, well, I don't
Confused.
know,
Yeah.
and then I said, well, think about it. What do you want to do about it?
Yeah.
And then they might come up with, well, maybe I want to like talk to that person. Like, can you set that up for me, like with their parent or with, a teacher at the school or something like that? Or maybe they do want to quit and then you can explore that. Well, if you quit, you know,
These
are you willing to quit something that you really enjoy over this person? You know what
Yeah.
I mean? And then give them some more, reflection time, before they just jump and make a decision. Um,
Right.
so just asking those open-ended questions that also get them to think and feel like they're part of the solution.
Right. Absolutely. While we're talking about solutions, I do want to clarify that you don't need to fix or solve everything to be a
Mhm.
safe person, too.
Right.
Right? Like, I think it's great to promote critical thinking. That's kind of what I hear Bethany doing with like her child and her clients. That's what I do. Like, promote critical thinking skills. We don't want to create like a yes man or woman, right?
Right.
We want them to be able to think for themselves and also hold themselves accountable for the choices that they decide to make, whether it's the right choice or the not so right choice, right?
Mhm.
So just realizing too that safe the safe person, right? Being a safe adult for a child does not insinuate or mean that you always have to have an answer or that you have to fix
Which I think is
everything.
what goes back to your 3 H's, because
Yeah,
they might just want
to be
to be
heard
heard.
or a hug,
Right.
like that reassurance.
Yep.
Yeah,
And they might not want help.
yeah,
They might just want to be heard or a hug.
yeah.
So I think that's actually like so good. I think asking, what do you want from this conversation
Hmm. And
at
just
the
like
beginning?
respecting that
Absolutely. And respecting it. Because sometimes like our kids tell us what they want and then we do what we
we
want
want.
anyways. And I think
Yeah,
that doesn't make us a safe person
right.
because
You can't trust you at that point.
correct,
Like you just asked me, I gave you an answer, and now you're not respecting
my
my
boundary that
my
I set.
boundary that I
Yeah.
set, but you expect me to respect yours, and now that's just an unhealthy
So I'm not
relationship.
going to talk to you again because
Yeah.
you're clearly not going to like hear what I'm saying anyways. You're just going to do
Yeah.
what you want
Like
anyways.
I can't trust you in that moment,
Hmm.
unfortunately. I think another thing too about being a safe person while we're on the topic of respecting boundaries and things of that nature is that, to be a safe adult is respecting, you know, the child's autonomy. What do I mean by that? It's like respecting like all of their decisions, and at least understanding. Respecting and understanding is not synonymous with agreeing. I have to be very clear about
Please
that.
be clear about that
I
because
say
we
that
usually
all the
don't agree.
time.
Let's be
Yeah.
honest.
So it's okay not to agree. You have your opinions and your beliefs, and your child will have, or your student will have theirs, and that's okay, right? But I think what's most important as the adult, if to still be a safe person, is understanding that there's going to be moments of disagreements where you're still trying to be that safe person, right? And that what the child needs sometimes is not always, hey, I told you so. If something goes wrong, like we don't want to do that. That's the opposite of being a safe person.
Oh,
That's
it's
not
so
nice.
hard. It's so hard too.
Yeah, I'm sure. Telling them, oh, I told you not to do that, or oh, only if you were to like listen to me, just that's not helpful. That pushes them more away. So those are examples of how not to be a safe person. So we definitely don't want to engage in those. Some more examples of being that safe person, regardless of role, is just, not just respecting their desires and their boundaries, but also realizing and remembering that like they're on their own journey, and kind of circling back to understanding and respecting like their decisions, but not always agreeing. I think that's like really important to
Mm.
remember.
Yeah. And I think consistency too. So if, let's say, you're a teacher or a parent, and sometimes I come to you with vulnerabilities
Hmm.
and you yell or you jump the gun and you call the other kid's parents or call the other kid to talk to them right away. um, and then other times you remain calm
Hmm.
and you just listen and ask them, what do you want to do about this, and let them take the lead and you just support them. But then you jump back to
Yeah.
the not calm. Would you feel safe like going to that person if they were inconsistent and you don't really know what you're going to get when you talk to them about these vulnerable topics?
Yeah.
Probably not. But if you remain consistent, and I know every time I go talk to Miss So and so about something, she always remains calm and she always is able to keep level headed and help me through it, I'm probably going to keep
Going
going and
to them.
talking to her,
Yeah.
right? Okay. So I think consistency is an important thing to bring into
Yeah.
being a safe
I
person.
hear what I'm hearing from you. A big takeaway is consistency in responses
Correct.
that are mostly neutral.
Yes.
Okay.
Yep. Absolutely.
Yeah.
Um, because yeah, I'm definitely not going to go, like I said, to that adult who I don't know what to expect in their
Hmm.
response, and it could make it worse for me.
Mhm.
right? I'm not going to that person. Um,
Yeah.
Trying to think practical ways for each person. And by person, I mean, again, going back to clinician, parent, teacher,
Mhm.
just because they're similar but different because
Yeah.
they're different roles. I'm thinking for parents, definitely, and I guess teachers and coaches and any other adults could do this too. But going back to like kind of what you spoke about in the beginning, like allowing the kids to fail, but
Mhm.
then also supporting them if they do fail,
Mhm. Without like rubbing
is
it in their face.
right. So, like, let's say, for example, um, my child, she's got homework expectations from school, and I say to her, if you want to do a sleepover on weekends or if you want to have a play date on the weekends, our expectation in our home is you have to have, not 100, but like an A in your homework grade, or you have to have no zeros. If I go on
Right.
these platforms and check and you have zero.
You set your
Right. Like
expectation.
you
Yeah.
can't have any zeros. You have to have an A as far as turning in assignments and homework.
Mhm.
Okay. You don't have to have an A on tests. You don't have to have, it doesn't have to be perfect, but we can't have any missing grades and
Right.
assignments. Okay. And then throughout the week, let's say your child is getting off task while doing the homework, or you ask, is your homework done? And they tell you, like, leave me alone. You're always riding my butt. Okay,
Mm.
fine. I leave you. So leaving them alone and allowing them to fail. But then when they fail and you check their account, on Friday and you see that they have a zero in something and you say, well, you have a zero and the expectation in our home is no sleepovers or no hanging out with your friends or whatever. And then they get really, really upset, not doing what Brittany said and saying, oh, well, I told you, and the expectations, but just saying, I know it really sucks. I know you were looking forward to that
Yeah.
instead, and being supportive of the fact
Mhm.
that they failed.
Yeah. And just say
Right.
there's always like next time, reassuring them that this isn't like the
Hmm.
one and only time that
There
they
will
can
be
earn
more
it.
sleepovers. There
More
will be
opportunities
more
to
times.
earn.
Yeah, exactly.
Mhm.
Not kind of going back. So allowing them, like, we set the expectation, it, fine, you don't need my help, you're not asking for it, so I'm going to allow you to take the reins. But then
Mhm.
if they do, still holding them to that expectation and supporting their feelings that this really does blow. You know what I
Absolutely.
mean?
I think for parents as well, one of the last things I want to add before we go to talk about teachers or someone like a different role, I think for parents, like not overreacting either, right? Like, again, remaining neutral in our responses as parents.
Hmm.
I do like the, like with the test and the expectations of the grades. I know for some kids they're like, oh, like the homework, and like if they forget their homework and they get a zero on it, and if they're calling you the morning of, like, mom or dad, right? Like, I forgot my homework, like I did it, but it's at home in my office, or like it's at home in my room, or I left it in your office, or wherever the kid left it, right? It's like, are you being helpful or are you being hurtful in that moment? If you as the parent go to the house, get the homework and drop it off at the school, what are you teaching your
Right. Are
child?
you going to do that when they're in college or when they have a job one day? Or,
Right.
they have to learn, I need to double check and make
Yes.
sure that my completed work is in my briefcase or in my backpack or in whatever it is, before I leave the house. I still
Yeah.
have to do that. I still have to pack my bag at night, the night before work,
Yeah.
so that I know in the morning when things are chaotic, I'm going to have what I need for that meeting the next day or that session or whatever it may be.
Yeah.
I mean,
Absolutely.
because mornings are just not my thing. And that is not the time for me to be packing anything.
Right.
Like, because it's typically I'm running late because I'm tired and I hit snooze 3 times. And I know that about myself because my parent let me learn by not bringing it to me. And I realized what happens when you don't pack your bag the night before.
Right. So learning the hard way, especially while they're younger, is super helpful, right? Because
Hmm.
they're going to learn one day, right? And also reminding yourself as the adult that you don't want your child to become dependent on you, right? Like, you want to create and foster and support and empower your child to be very independently critical thinking, responsible adult one day, correct?
Mhm.
And so just reminding yourself that your child cannot go to you for everything. Teaching your child how to be responsible is also a part of being a safe person or safe adult for a child as well.
Mhm.
I think for the role of teachers, one of the things that I would like to add for teachers who are tuning in on like how to be a safe person as a teacher for students is if you notice anything differently, instead of going straight to the parents by like calling or writing a note,
Sending
having
an email
sending an email or anything of that nature, or even embarrassing intentionally or
in front of the
unintentionally the
whole
child.
class.
Yeah, I'm totally against that. But I think teachers, one of the biggest things that I would suggest to you guys is just doing little check ins, right? Like, whether that be like at recess or whenever you're like transitioning to like a specials course, or if you have like older students who are in middle school or high school and they're going from like one class to the other, maybe like pulling them aside like quickly or something like that, or talking to them and just doing a check-in like, hey, like how are you, hey, like I'm noticing this, and like genuinely caring. And I didn't reach out to your parents just yet because I wanted to talk to you first to give you an opportunity to turn this around because I believe in you,
Mhm.
right? When you just kind of like not even address the child as your student and you go straight to the parent, what kind of relationship are you fostering with that student?
Mhm.
Right? Like the student is the individual that you are working with and teaching, if you will, 5 days out of the week,
Yeah,
six
they're
to eight
with you a
hours a
lot.
day. Yeah, absolutely. So that's my little tidbit for
Yeah, and
teachers.
I think because yes, I think sometimes and I can't even pretend to imagine how difficult it is to be a
Yeah.
teacher with all of the students and I mean it's just so
So
many
much.
students
Yeah.
and so much responsibility. That's why I'm not a teacher.
Hmm.
I don't know if I could handle it, but um, I know sometimes it's easier just to address in the moment, and that's why it does get addressed sometimes in front of the whole class or whatnot. But
Hmm.
I think then it can embarrass them,
Of
and so
course.
even if you're like, hey, like you're talking again, and I told you to stop talking, like with your friends, like, and you feel like, well, I addressed it with them. I told them to
Yeah.
stop talking. You know what I mean? But maybe like pulling them, like you said, aside later and saying, like, hey, like, you're a good kid. So I have to know like
Why
what's
are we
going
making
on
these
with you
poor
because I told
choices?
you, the rules. We have them hanging in the classroom.
Hmm.
I've stated them, but yet you continue to keep doing this and it just doesn't seem like your character. Is there
Right.
something going on? Before reaching out to the parent, they're going to feel like you did it when you actually tell them later on, like, I really do have your back. They're going to
Right.
be like, I believe you. And
Yeah.
then I just continued to, do what I was going to do.
Right.
Then if you just jump right to like the email after the prompt in front of the class, they're not going to feel like you have their
Right.
back.
And then that could just lead to just more behaviors, I think,
Right.
like long term,
Yeah,
right?
definitely.
And that's not fostering a healthy relationship between the teacher and the students, or students, plural,
Yeah.
right?
I feel like as clinicians, being a safe person, yet setting boundaries looks a little different. I'll go back to my teenage client, with the breakup thing. What I've been doing for him recently is just holding space for him,
Hmm.
allowing him to vent, say everything he needs to
Yeah.
say, and then maybe like next session, the session after, saying, hey, I was like thinking on everything that you said last time. And then again, bringing up like those critical thinking like points.
Hmm.
So, for example, he was saying how all of these friends and older classmen were kind of like talking to him and giving him advice and walking with him to class because this girl, you know, kept harassing him in school and it was causing a lot of problems in school. But then in the same breath, when he was venting, talking about like how he's taking her back, then they have another fight, then taking her back. And so I didn't in that session like say like, hey, like, how
A
do you think,
challenge.
right, challenge, because I wanted to hold space and
Yeah.
like let him like just get all of his feelings out and feel supported. But then in the next session, I said, I was thinking about this and
Mm.
um, I thought to myself, and I just wanted to ask you, like, how do you think, like, all these people that, have been supporting you and standing up for you, how do you think they feel every time they put themselves on the line to show you support, but then you go back?
Hmm.
Like, do you think that's gonna hurt your relationship with them at
Hmm.
all? And then, it was kind of like, yeah, I think it might. You
Yeah.
know what I mean? So still holding them accountable, just but maybe not in that actual session, in that
Right.
actual moment.
Right. Which is so
Right?
critical. I think also it's important as clinicians to remember that our goals are not the goal of the session. Sometimes we have to take the lead of the
Hmm.
client, and sometimes what the client needs is just a listening ear, right? Someone who is present, someone who's person centered in that moment, if you will, who's empathetic with positive regard, and also just like really like listening to them, right? Hearing
Yeah,
them out, kind of like what you were
absolutely.
saying.
Because safety plus boundaries equals growth. I
Yeah,
think a good analogy that you use all the time is that boundaries are not walls,
yeah,
but
they're not.
they're guardrails.
Hmm.
That's when you like to use.
Like bowling, you know?
You used that the other day. You said,
Mhm.
what are those little
Yeah, the
things called? The
guardrails. Yeah, so
guardrails,
the guardrails when you go bowling, it's
which I
like,
still need.
yeah, they're guardrails, and it's not rolling the ball for you, but it's kind of like, okay, like I'm kind of helping you. I'm being your safe person, so at least you don't spiral.
Yeah,
So at least you don't completely like lose it. You will fail, you will fall, but we want to prevent crisis. We want to
you
prevent
still
those.
might even get a gutter ball with those guardrails up.
Yeah,
I've
you may
actually done that. I know
sometimes.
it sounds impossible,
Yeah,
but
less frequently, right? Less frequently. But I think it's really important for clinicians to remember that, not everything is going to, just reminding yourself and remembering that not everything is going to be fixed in one session.
right. And we can still be a safe person while holding these kiddos accountable so that they can learn and
Hmm.
grow and feel like challenged and capable, but yet
Absolutely.
supported.
Yeah, I think it also depends too on the type of therapeutic relationship the professional and the client have in that moment.
Hmm.
If you're still rapport building in the very early stages, if you will, of the therapeutic journey, do not
Or you're
like
a new
challenge.
teacher at the beginning of the year and you don't really know
Right,
that kiddo,
right, very,
because it's only September, and you've only had them in your class for a month and a half.
right, right. And you're still kind of like feeling out the waters. Definitely do not engage in any like challenging techniques, but be more supportive, acknowledge, still be firm, right? And stand your ground and like implement and like maintain your boundaries as, whatever role, parent, teacher, coach, clinician. We're about to get into like other caregivers, which it's very comparable to teachers and also to parents, I would say, right? I
Hmm.
think for caregivers, just providing structure, you know, letting the child or the children know what the expectations are. Um, Having that calm presence as a caregiver is super important for being like that safe person. And also just kind of saying too, like, hey, I'm not your parent, but I am here to support you, right? And just kind of getting that narrative across without overstepping either, right? Because when I'm saying caregivers, to be transparent, I'm insinuating and including like babysitters and nannies and
Hmm.
things of that nature, whether you are related to the child or not, because some babysitters can be aunts and uncles
Yeah.
and older siblings and things of that nature, right? So whenever you are in the role of a caregiver, insinuating that you are not the parents, right? Saying that to the kid, like, hey, like, I'm not your parent, right? There are things that I'm going to do that's kind of different from your parents as well, but kind of remaining consistent in the sense or in the capacity of, if they mess up under your care, not rubbing it in their face or anything of that nature. Hey, like, I understand that you would be upset in that situation. I could see how you could be upset.
Hmm.
That would upset me too. Like, kind of normalizing that. What have we learned from this,
Yeah.
right? How can we calm down from this? What can I do to help you calm down from this? I see that you're having a moment. Would you like space? And like respecting that,
Yeah,
right?
definitely.
But definitely not like, well, I told you so, or next time you better listen to me, or anything like that, because that's not going to be very helpful long term, is it? It's just going to add on and create, I think, like more animosity.
Mm.
So we want to avoid that, I think. But yeah, safety plus boundaries definitely equals growth. I think children, or just people in general, to be honest, we thrive when we know it's expected of us, right?
Absolutely.
And I think if we know that there's no limitations with our safe person or safe people, right? And we can go to them for whatever, I think that's going to be the best, because
Mhm.
I hear it all the time from my like 3 year olds to like my 50 something year old, 60 something year old clients. And they're all like, you are my like safe person, because I know that whatever I tell you, it won't be weaponized. It won't be held against me.
Yeah.
Even if I'm saying it out loud and I know that this is morally wrong or technically wrong or emotional sabotage or not what we talked about in last session or not the homework we discussed last week,
Mhm.
or it goes against the grain of what we've discussed in past sessions, right? Like they know that I can understand where they're coming from. I can respect the decision that they made in that moment while also still holding space for their emotions presently.
Right.
And also like letting them know, like, I believe in you. Like you could do a lot better than that, right?
Mhm.
And still being that safe person. So there is a way to go about it. So I hope you guys found this video helpful. I know we threw a lot of things at you guys. Um, but yeah, I'm excited to kind of launch this particular episode just because it is super important to understand as an adult how to be a safe person for a child while also still maintaining boundaries
Yeah.
as well, because boundaries are going to happen whether you implement them or someone else in your child's life implements them, right? And so it's important that they also have a safe person that they can always go to and confide in, because like what Bethany was saying earlier, they're either going to hear it from you or another adult, which is preferred, or they might hear it from a peer or one of their siblings, you know,
Or
friends,
TikTok.
or TikTok, the Instagram, or whatever else they have, the social media stuff, Hollywood, the movies, the internet. I can keep going,
Yeah.
right? Even on games where they can like chat with each other. So again, you want to foster this very healthy, open relationship and be that safe person for your child without enabling, right?
Correct.
So, again, I hope you guys found this video helpful. Thank you for hanging out with us on Air with B&B. Remember that your mental health matters, and we'll see you next time in our next video. Thank you. Bye, guys.
Bye.